So I realized that I never actually did any kind of intro to my video. I'm Vicky. I am pregnant and also a post-bariatric surgery. I had a gastric sleeve, I want to say vasectomy, but that's vertical sleeve gastrectomy, not a vasectomy. And so I wanted to kind of make a video about that combination, so being pregnant post bariatric surgery. And I recorded the clips over the last couple weeks, mostly 2 different times. So, and that has most of the information, but just wanted to say, that's what you're in for. So, oh my God, I just realized how crazy it looks. So, and also, if you can see behind me, I'm at a liquor store, which is where I work, part-time at least. So, back to what I was saying. I want to talk a little bit today about my experience as a pregnant woman post-bariatric surgery. So for reference, I am 14 weeks pregnant right now, so just got through the first trimester. I'm entering the second now, and I am a year and a half, right about a year and a half post gastric sleeve or vertical sleeve gastrectomy. And I've heard people, I did find people online that were talking about their experience, but I didn't feel like it was as, I didn't feel like I found what I needed. So that's just a little bit of background. I did kind of try to organize my thoughts a little bit, but probably not enough, as you'll see. So I guess to start with, well, actually, let me also say, so I started before my sleeve. I was 315 pounds, and I lost, I think it was 65, and I was right around 255 when I got pregnant. So there are a lot of people who did a lot better than me, and that's fine, but and I could have done better. I'm not going to get into that, but I did lose a good chunk of weight in that year and a half. So I guess the first thing that was different about a bariatric pregnancy is I had to wait a year after my surgery to get pregnant, and I think most programs want you to do that, but my program was very insistent about that, that we wait a year. And I mean, really, it makes sense, because you don't want to that, it screws up the nutrition for the baby, it screws up your weight loss, all of that. And I really wanted to give, the whole reason I got the surgery, not the whole reason, but a big reason why I wanted to get the surgery was to be able to get pregnant and sustain a healthy pregnancy, and I knew losing weight was going to be part of that. So as far as getting pregnant, it was really at the 1-year mark. I had an IUD before that, and it was really at the 1-year mark that I had my IUD removed, so 1 year post-surgery. And the interesting thing was, I had never ever had a regular period in my whole life. From the time I was 13, and got my period, it was never regular. I had all kinds of tests and things done to see what was wrong with that. I was at some point diagnosed with PCOS, which honestly I feel a lot of, especially if you're plus size, you probably have been diagnosed with PCOS. It seems it's a pretty common thing at this point. And so once I got the IUD removed, pretty much instantly my periods became very regular, no spotting in between, which was a big issue for me. I would start my period and I would keep bleeding for months and months. It would be super light, but yeah, it was always so annoying. And so the IUD stopped my period completely, and then when I had that removed, like I said, pretty much right away, I had a period 2 weeks, I think, after it was removed, and then pretty consistently like monthly after that. And to be fair, like I only ended up having, so I got it removed in November, and then in March I got a positive pregnancy test. So it wasn't like I had a lot of months to like, I didn't have a long history of periods. But it was kind of exciting for me to like have that. And I am suspicious that it was probably like weight loss, but also I'd been on an IUD or like some form of birth control for like a decade, so like who knows at what point my period became normal. I don't know. And if maybe it wouldn't have stayed normal, I also don't know that. But that I think really helped me as far as like being able to get pregnant in a relatively fast way. So to go into a little bit more detail, back in November I mentioned that I don't know what I'm doing. I mentioned that I had my IUD removed, so that was like a year post gastric sleeve. And so I just made an appointment with my gynecologist, had that removed, let her know that like they ask you like, why are you getting this removed? I'm like, to get pregnant. Which like I don't know, felt funny to me at the time, but like I mean, I guess there's a lot of reasons for having it removed, but yeah. And they said basically if there's like a chance that you'll get pregnant in the next year, or like you're trying to get pregnant in the next year, that you should go ahead and start prenatal vitamins. So I did that. I was not like super consistent at the prenatal vitamins before I got pregnant, but I did get some, and I have mine here actually. So I take the prenatal bariatric vitamins from ProCare Health. And I actually recently met with my dietitian through the weight loss program, and she kind of went through it and said that it looks like a good vitamin to take. So got that started-ish then. And then once I actually got pregnant, I got a lot more consistent with those. But I did try to at least like give myself a bit of a head start with that. So at that appointment, we also talked about like what other meds I would need to like take or stop. And at that point, I was on an antibiotic for I have rosacea, so I was on an antibiotic for that. And it was not a pregnancy safe antibiotic, so they told me to stop taking that. I am on a SSRI, so like a antidepressant, anti-anxiety. I am taking sertraline, and they said like, you know, we don't want a sad mom, so like don't go off of it if you can't. But I did say like I increased the dosage at one time because I was in like a really stressful point in my life and I kind of needed a little extra. But I wanted to kind of trial a lower dose to see if that would be fine for me, and it was fine. Like they said, yeah, that's fine, you can try the lower dose. If it doesn't work, go back up. But you know, so that was something that it was just like a slight decrease, so I didn't have to like titrate it or anything. So that was fine. And then the other medication that I was taking was phentermine, which is supposed to help with like cravings and like an appetite suppressant. And I'd started taking that like maybe a year after surgery, because I'd hit a pretty long stall in my weight loss. And then I had started taking that to kind of see if that would help boost that. And it did, but they said, and it was kind of one of those things, I was like, do I have to stop now or like when I have a pregnancy, like when I get pregnant? And they said that was one that I could take until I had a positive test. And I just basically finished out the prescription that I had, and I wasn't taking it at the time I was pregnant. Whereas the antibiotic, they were like, stop taking it now so it can get out of your system by the time you're pregnant. So there was kind of like different versions of what they wanted me to do. Alright, I've been recording this in chunks as customers come and go, so I'll try to make sure that I edit it in a way that like makes sense and that I'm not just repeating myself 14 times. So I talked about, you know, I had the IUD removed. That was in November. And then December, I had my 1-year follow-up with the bariatric program, where they like take all your all your blood work and, you know, just kind of check in to see how things are going. And at that point, I did the check-in. My labs all look good. I told them, my plan was that I had my IUD removed. My plan was to get pregnant, whenever that happened. The only thing they really said at that point was that once I got pregnant, then they wouldn't continue to like see me at that point, or they wouldn't see me while I was pregnant, because like when you're pregnant, the goal is not weight loss, and like that is what they're there for. So they kind of said that. It was actually really lucky for me. The former like nurse practitioner, like women's health nurse practitioner that I did see, who like actually gave me the IUD, had just switched to the weight loss clinic, and it was like super random, but like she was still shadowing a doctor because she had just started, and it was, so she was there and like the weight loss doctor was there, so they're both there, and it was nice to like be able to kind of just talk through things with both of them and like find out, are there things I should be concerned about. And this was also the point, like some of the like medications I talked about at this appointment, some of them I talked about with my primary care doctor, and some of them I talked about with my women's health appointment, because within that month I saw all 3 providers just to kind of make sure that it was because it was like they were due, but it was like also just to make sure that I had that everything was good and I was like good to go, and none of them had concerns with me starting, like trying to conceive. And yeah, I think that was it for that appointment. And then so got pregnant in March. That went like surprisingly smooth. And then I had my so far it's been a very normal pregnancy. I will say like some of the symptoms that I think are different. All right, so as far as like pregnancy symptoms, I mean this is my only pregnancy, my first pregnancy, so it's hard to say like what was a normal pregnancy, like what is a normal pregnancy symptom and what is because of my bariatric surgery. So I'm now pretty much like being out of the first trimester. I'm lucky that I don't have any of those symptoms that have lingered into the second trimester. But there were definitely a few weeks during the first trimester where I had a lot of the nausea, the vomiting, things like that. And I will say like it was really hard for me to like figure out, like if I got full really fast, and if I felt really full, like I felt miserable. Like if I got too full, it was miserable, and it was worse than before. Like when I wasn't pregnant, like yeah, that would happen, but it didn't like last as long. And they do say during pregnancy, like I think it's like your smooth muscles or something like slows down, and so your digestion slows down. And I think that was like compacted by like my reduced stomach level. So it was really like a fine dance of like figuring out like how much I could eat before I felt like really sick, but also like if I got hungry I felt sick then too. So I definitely had to like go back to like eating, like I couldn't eat a full meal, like I had to eat snacks throughout the day, which to be fair like post-bariatric surgery is what they recommend anyways, like eating like a small meal every 3 hours, or at least in my program that was what they recommend. The trick is also then like separating liquids from solids and like being able to get enough water in, because I really am like trying to prioritize like drinking enough water. I'm not great about that, but especially because my digestion was so screwy and like I was so constipated. I still am, like I am lucky if I don't poop. It's terrible. So I do try to prioritize the water and like the fiber and things like that. But when you're eating every 3 hours and you're trying to separate your liquids from your solids, which to be fair, like that's the first thing to go for me. Like if I'm not getting enough water, I'm not going to separate my liquids from my solids. And I recognize that like that helps with weight loss, and like but like my primary goal is to like keep a healthy pregnancy rather than like losing weight. So that was something like, it was a very, there was a lot of trial and error, and there was a lot of like me feeling sick and like figuring out what I could eat and what I couldn't eat, and trying to like get my protein in and things like that. And I did reach out maybe like 3 weeks ago, like week 9 or week 10. I reached out to my bariatric program, and I asked to meet with the dietitian, and I did that. And like I mentioned, she kind of looked over my most recent lab work, and she kind of made some recommendations based on that. Like, and she did say like I wasn't consistently taking a prenatal when I got my lab work done, because that was back in December. And like I said, once I got pregnant, I was a lot more consistent with that. So she said probably some of those, like I had a vitamin D that was a little bit low. I don't remember, that might have been it actually. And she said that's probably worked itself out with regular vitamin. She made a couple other recommendations. She told me to increase my B12. I had, and to be honest, I had really like, there's a lot of supplements and like vitamins and supplements you're supposed to take post bariatric surgery, and once I hit like the 9-month mark, I really kind of tapered off with those, and I'd really just been taking like an occasional multivitamin. Like, I'm not a good bariatric patient. I've never claimed to be. And I said, like, what should I prioritize? You know, like, I am taking the prenatal, I'm taking the bariatric prenatal. And she said that was good. And I asked, because I'd heard people who had bariatric surgery say, like, they were told to take 3 pills instead of 2, or like they were told to adjust the dosage on their bariatric or on their prenatals. But she did confirm that mine was fine, and that 2 a day was sufficient for me. But she did recommend increasing my calcium, like reintroducing a calcium supplement, and she told me to do that slowly. Like, don't start with taking, I think the recommendation is 2 a day. She said I should work my way up to 3 a day, but start with 1 a day. So that way I don't remember what the risk was in that, but she told me to slowly reintroduce that. So it was calcium and B12 were the 2 that she told me to restart. And then I asked about protein, because that's like a big thing after bariatric surgery. They're always pushing the protein. And she said just aim for the upper range of that. And so for me, that set like the upper range of like what's recommended. And so for me, she said 80 grams should be good. And we kind of like walked through my day and like what I'd been eating and things like that. And she said I'm likely getting that. She just made like, her one recommendation was to like get more protein in the morning. But like I said, like I was my best like I was the best bariatric patient especially when I was like having like nausea really, or like the worst of my nausea. Just because like I was doing a good job of like doing what I was supposed to for the first time in a while. So that was a good time to check in with her, because I was doing what I was supposed to. Whereas like 6 months ago, if I would have met with her, she would have been like, "Oh, change everything, just stop." So that was good, and that was helpful to just kind of like be reminded. And she kind of reiterated too. She was like, "Do your best to separate liquids from solids, but like not at the expense of like losing hydration." So it was kind of good to just have that kind of reiterated, and that type of stuff. All right, so the last thing I wanted to address is kind of me being a high-risk pregnancy, and there are a couple of reasons for this. So the first being that I am 36, and anything over 36 years old, and anything older than 35 is considered a geriatric pregnancy. So that's kind of a number one risk factor for me. I'm also still like clearly overweight. So I'm still, I did lose weight, but I haven't lost enough to be like in a healthy range. And then also because I'm a bariatric patient. And I knew that going into this pregnancy, and I was very upfront with my physicians. Like, I don't, you kind of, at least at my practice, you get the choice to like go with the midwives or go with the OB. And so they said because of my risk factors, like I really would be better off going with the OB, because they can do a lot more medical intervention. They do, like, it's a high-risk pregnancy, and they're more equipped to handle that. So so that was kind of like, but it didn't really seem like anything mattered. Like, it didn't seem like it was going to be a big deal. Like, they seemed very well prepared in a regular, like, OB office to handle that. And then at my last appointment, so previously I met with, like, I just had a sonogram, I had met with, like, I did lab work, and then I met with a nurse practitioner, and then my most recent appointment, which was week 13, I believe, I actually met with the OB, and she was like kind of asking about the vitamin, like, absorption, things like that. And she said she has had patients who did the Roux-en-Y in the past, and her plan was to kind of just follow that template of, like, which vitamins to monitor and things like that. But she said she was going to reach out to the high-risk specialist, like, that they contract with or whatever, the high-risk clinic. And they had told me, like, in the past, like, they may do increased growth scans or stuff like that, like, as my pregnancy goes along, just to make sure that baby is getting all the nutrients they need, like, depending on, you know, how that all goes. So they said there may be things, like, down the road that would be different for me. But then she followed up with me after my appointment and said she had reached out to ask about, like, the vitamins and stuff like that she needed to monitor for, and they said that they wanted to see me at the high-risk clinic. And they also said something about I'm on a medication that makes me high risk, which I don't think that's true. I feel like maybe they have the wrong information, but they said because of, like, the number of risk factors I have, they want to do a consultation with me, and at that point they will give me more information about, like, okay, what kind of follow-up, will I need any additional follow-up beyond, like, just a regular pregnancy? Should I switch my care to the high-risk clinic and not at the regular OB office? You know, is there anything that they want to do? You know, do they want to schedule the additional growth scans or whatever? But yeah, so that's that. So the other thing that I forgot to mention, sorry, my nose is itching, is that I was diagnosed with non-alcoholic fatty liver disease. So when I got my surgery, I also enrolled in a research study where they were, like, researching liver stuff. And so in the process of that, they diagnosed me with non-alcoholic fatty liver disease. I haven't had any symptoms or anything, and my blood work is coming back good now. But because I had the history of that, and, like, liver issues can come up with preeclampsia, that was kind of another thing they were concerned about. So I think with all of that, like, yeah, I know that's, like, a lot of risk factors stacking up. So, but I will, you know, check back once I meet with the high-risk clinic and have more information about that. Alright, so overall right now everything's good, everything is healthy. There's a lot of things, obviously, like with anybody, there's things to keep an eye on, and I am so grateful to have, like, to be in a city that has the resources and, like, has a high-risk team and has, like, the bariatric team and, like, have so many specialists that are, like, keeping an eye out on things that can kind of step in if things change, or, you know, like, I'm grateful for a healthy pregnancy, but I'm also really grateful that there is I have so many resources, like, available to me, like, if things change, or, you know, to kind of keep on top of those things. It feels like a lot of appointments right now, between, like, keeping up with, like, all the bariatric stuff and the pregnancy stuff and now this high risk stuff. But again, I am really grateful to have a great team that, like, works together really well, and, like, yeah, I'm grateful. And hoping that everything stays going smooth and good. All right, so I just want to film a quick little, like, addendum. I am currently at 16 weeks, I guess almost 17 weeks, but so this week I had my 16 appointment with my OB. Actually, I saw a midwife this time because my OB was at the hospital. And then I had just today my consult with the high-risk perinatal clinic, or, like, I met with the MFM, the maternal fetal medicine specialist. Sorry, I was thinking family was the F, but that's not. Sorry, I keep touching myself. But and everything so far looks good. This week at my appointment, They did like the blood work to see if there are like neural tube defects, and that all came back normal. Everything looked good there. And then I was meeting with the specialist to see basically like how much, like kind of make a plan for my pregnancy, to see, was there additional testing I needed to do? Was I going to need to switch my care to the perinatal clinic? Was I going to, do some of my scans there and some at my regular OB office? Just to kind of see where we were at. And that appointment was very helpful. I felt like we really went into more depth on like my history, my surgery, like, and my regular OB like knew that there were, she knew about weight loss surgery, but she like didn't know the same or didn't have the same like level of you had the gastric sleeve versus the Roux-en-Y, and so we don't need to worry about this, whereas if we did, we would worry about this, like had a lot more sense of like the fine details. I'd also in the past, like when I had my weight loss surgery, I participated in a research study where my liver was studied as I lost weight. So like when I had my gastric sleeve, I had a biopsy taken of my liver. And then a year post-op, I had another biopsy taken of my liver. And then I had like a lot of blood work done and a lot of like MRIs and ultrasounds done throughout that year. So there was like a lot of records of my liver, and including like the 2 biopsies. And the MFM was like, I saw that, and she was like, I have had patients with like really high like liver numbers or really low, whatever liver numbers are really bad. And she was like, it's really hard to get them to even like do a biopsy. So I thought maybe there was more going on. Like if you got a biopsy, like maybe there were more concerns than we like worried about. But once I explained that it was a research study, and that I wasn't necessarily that like, what she saw is what it was. And she did confirm that my liver numbers are all good. Because I was in that process diagnosed with non-alcoholic fatty liver. I don't remember. I think there was like a stage or I don't know. But she said all my liver numbers looked really good. She said my A1C, like my blood sugar levels all looked really good. Those are things that in the past had been abnormal. But then I think with the weight loss have kind of normalized now. So that was all good, and she felt really good about that. She also like asked about, where is your weight loss? Are you still losing weight? How far post-surgery are you? And she felt like because I'd gotten to a place where my weight was very like stable and consistent, I wasn't actively like, losing weight anymore, then that was like a good place to be pregnant. And she made a comment. She was like, nobody ever waits the year. She was like, people are always here 6-month post-op. They're like, they never wait the year. And I said, well, I did. Thank you very much. So she was happy with all of that. We also went a little more into like family history. Nothing was like of relevance, but she just kind of got a like fuller picture of what was going on, and ultimately decided that they didn't need to continue to follow up with me. I will do my like 20-week anatomy scan there because that was already like, that's just what my clinic does. They send people to the hospital because they have, I guess, they have differently trained like sonographers, and they have different equipment that they can get a better scan for that 20-week appointment, because that one's like pretty in depth. So that was already going to happen. And she did say like, and it was really kind of unclear to me, like how, like, it sounded like I might have additional growth scans, but I'm also not sure if those were like the normal growth scans. So yeah, I might end up having additional growth scans, but I'll be able to do just to kind of make sure that the baby's getting all the nutrients in like the last trimester. But otherwise everything was normal, and she said all of that could be done in my regular OB's office except for what had already been scheduled at the specialty clinic. So that was good. It made me feel good. We got to do the Doppler, got to have a little like, the nurse called it a cheeky peek at the baby, so it was just like a little handheld ultrasound. so they could find out where she was. Baby's looking good, heart rate's good. Yeah, so everything is good, and I was really happy to be able to kind of stay at my regular OB clinic. I hate going, it's just more stress to go to the hospital. Like, it's just more of an ordeal to have appointments there, just because of all, like, the extra additional security and the extra, we had to give my husband's ID to be able, for him to be able to come, and blah, blah, blah. So I was really glad that not only is the pregnancy going well and I'm doing well, but that, like, follow-up care, at least for now, can all be done within my regular clinic. So that's good news. So this should be the last clip for this video. Sorry that it's taken me like 14 times to get this right. Clearly, if you haven't figured it out by now, you'll know that I'm not a YouTuber and I don't really understand editing. I tried to do different things and nothing ever worked, so I just kind of left it alone. But that is my video. Feel free to let me know if you have questions. I don't know what kind of, updates or follow-up I'll be doing. Really, I just have wanted to kind of document what I was looking for myself. So maybe it'll be helpful for somebody else. All right. Thanks for watching.